Hello everyone. Hi. I'm here to tell you a little bit about my PRK experience. From the beginning, a little bit before the surgery, until the moment I am right now, which is 2.5 months post-op. Well, my prescription was for myopia and astigmatism. I had -6 for myopia and 1 for astigmatism, and I had the same prescription for a little bit over 3 years. Then I decided to have my surgery. When I went to the doctor, we had to do some exams before that. I had 5 exams done in my eyes just to assess if I was eligible for the surgery. The exams were varied, but overall they were looking for information about my retina health and also my corneal health, most importantly. They also took all sorts of measurements of my cornea just to see which procedure would be best for me. After we had the results, everything was fine, and my doctor told me I was eligible for either LASIK or PRK. Either one was fine. We decided to go for the PRK because I had the time to recover from the surgery, which is longer, and also it's not as invasive as the LASIK. As you may know, in the LASIK, you have to do a corneal flap and then you put up the laser. And in the PRK, we don't do the lap, but we just brush off the epithelial cells of the cornea. And then these cells have to grow back and then you will see back again. But there are risks with the LASIK, with the flap, even though they are minimal, and the surgery, both surgeries are very safe. But I decided to go for the PRK because I had the time to recover and it was the best option for me at that moment. So we decided to go to do the surgery, and it was a very quick surgery. Before the surgery, um, at least in the place I did, I had to put up a gown, and it was like I was going into general surgery or something. It was somewhat recomforting, you know. I wasn't just walking in there, and I felt safe because they had a lot of precautions, even though the surgery is very quick. Um, they they gave me a little medicine before just to calm down a little bit, made me a little sleepy, takes off a little bit of the anxiety as well. And then I went to the surgery. The procedure took about 15 minutes or less. It was very quick, it was very fast. It was fine. My doctor was with me and she was telling me everything that she was doing while she was doing, first brushing off the epithelial cells, and then when I was ready, put up the laser, and then do the same thing with the other eye. So she was explaining a lot to me at the moment, which was good. Then after that, I got out of there walking with sunglasses. That was the only thing. I went home, and I was lucky to have someone taking care of me because you will need someone to take care of you, since you need several drops to be put at different times for that first week and especially the first 2 3 days. Then you will need someone because I couldn't read. The light was too intense for me. Even though I was after the surgery, I got out of the bed of the surgery and I could see what, but I just couldn't. After a while, the light would hurt too much my eyes. And speaking about the drops, I started taking the eye drops a day before the surgery, which was antibiotics. And then after the surgery, I just continued with the antibiotics plus corticoids and anti-inflammatories and lubricating drops, all of that. So it's a lot of drops, a lot. And speaking a little bit before the surgery, a hint that I give you is go to the surgery with a buttoned up shirt which is easier for you to take off when you get home because you don't want anything coming near close your eyes. Also, wash your hair before the surgery because this is going to be a little bit of a challenge to wash your hair the following week because you also don't want any shampoo coming any near close your eyes. You can wash your face, like normally you wash your face a little bit. It's just don't scrub your eyes or anything like that. Just be gentle about it. I think you need to be a little bit more cautious about that when it comes to LASIK because of the flap. But at least in the PRK, you just have to be gentle about it and have a lot of precautions. So that first day after the surgery, it was good. I was very sleepy from the medicine, and I just slept that whole day. The following day, my surgery was on a Thursday, so the following day, on the Friday, I went to see my doctor, and she said my eyes looked fine, and it was everything okay, and I would have to come back there on a Tuesday of the next week just to take off the contact lenses. It's a bandage contact. It's just to protect your eyes. We took off the epithelial cells, so your eyes needed a little bit of protection. There's no prescription that contact. It's just to protect your eyes. So on the Friday, I was fine, and then Friday night, my eyes started to hurt. It was like there was sand in my eyes, and it wasn't very great. So I just went to bed. And Saturday was a very nasty day because I had a lot of pain, and I even took another medicine to sleep through that day. So Saturday and Sunday, there were days that I could not open my eyes very well. I just couldn't. The light would hurt too much. Even when I was in the dark, sometimes I couldn't open my eyes. They just needed to rest. So I took that time, and it was very bad. But on the Monday when I woke up, I didn't have anything. I was fine, and it was such a relief. I was so happy that my eyes were not hurting and I could open them and talk to people and go outside, always wearing sunglasses, always with sunglasses on, of course. And the light still hurt, and sunglasses, we still need to wear sunglasses when we go outside, even a year after the surgery, because we're still trying to protect them as much as we can. So on Tuesday was my day to go back to my doctor just to take off the contact lenses. And I was looking for that because if you ever wear contact lenses in your life, when you have them for too long, they just get so dry and they bother you so much. And it got to a point that it didn't matter if I was lubricating my eyes all the time because they would still bother me a lot. And it was awful. Like having that contact lens is really bad. But when I got to my doctor's, we took out the contact lenses from the right eye, but the one from the left eye was gone. I don't know when I lost that contact. I don't remember it slipping out of my eye, and it was just gone. She said that happens, and something that to move on with. So after that appointment, she told me to go back there after a month or so. I had a trip scheduled, so she told me, "Oh, come after this trip because it will take as long time as possible. It's even better." And I started the process of getting better every day. Every day I would wake up and I could tell, oh, I can see better. My eyesight was coming back slowly every day until it got to a point that I would wake up in the next day and it was pretty much what was before. And I still had a lot of room for improvement. And that's a little scary, you'll get a little nervous because you expect to just get better in no time. And that's not how it happens. Your body takes some time to readjust to heal, and especially in your eyes. If you cut yourself in your skin, you make a scar, and that takes time to recover. It's similar when it's with your eyes. It's gonna take some time. My doctor told me 2 weeks and I could do my normal activities. Yes, technically, after 5 days, I could see things in the computer and use my cell phone, even though I had to enlarge everything for me to be able to read. But I kind of could do. I could be functional. I had a functional eyesight. After 2 weeks, I could drive during the day, not at night. The night at night was still a little bit bad, and the lights would still be a little bit too strong. That light, especially the lights from the other cars. So at night I could not drive, but during the day I could. But I still had a lot of room for improvement, and that's when you have to be patient because you just have to trust your body, your doctor, and it will get better. I was desperate during that time. But um, it was out of nowhere, and it was 5 week 5 weeks after the surgery that my eyesight got really good. So, as I told, my surgery was on a Thursday, and the 5 weeks it was on a Thursday. So on the following Sunday, after those 5 weeks, I woke up in the morning and I was having breakfast. And I was in the kitchen and I was mesmerized looking around the kitchen because I could see perfectly. Everything was crystal clear. The images were so crisp, full HD. And I wish people could see what I was seeing because I was amazed by that. I could not even see that good when I had glasses on. And I was seeing perfect. For me, it was 5 weeks, but to other people, it could be shorter, it could be longer. You just have to keep in mind that we have this window of a 3 months period that your eyes are still healing, your eyesight is still improving up until 3 months. That's like a time frame where you can really assess if the surgery did what it was supposed to do or just partially. And to me, it was 5 weeks, and I was really happy for that. I even told my doctor, "Oh, if I had come here in the appointment, if I had come here the week before, our conversation would be completely different," because I was still desperate back then. um, right now, I am 2.5 months later. I had an appointment last week, and we were checking for if any residual prescription there. My myopia is 0 at the moment. I am healed from that, cured from myopia. I still accept 0.25 of astigmatism in both eyes, but that's not even significant. I don't really notice that. Maybe I notice in the night when it's night, but really late in the night. I could tell a little bit of astigmatism. I can tell there is, but it's not something that impairs me to do anything. Like, it doesn't bother me. Sometimes I don't even notice. It's just if I'm really tired, and your body gets tired. And even if you go out there in the world and take everyone, dilate the pupils of everyone, and check if there is any prescription there, you could find 0.25 of astigmatism in people who say they're perfect, their visions are perfect. So I am very satisfied with what I can see right now. And I still have room for improvement because there's still half a month for my 3 months mark. And I hope my eyesight gets even better if that's even possible because to me, I can see perfect. Um, there are two things that I'm still doing, which is sunglasses, wearing sunglasses all the time when we go outside. All the time. I'm very strict about that. Sometimes even inside the house, when I wake up in the morning, I get out of the room is dark, and I get into the other parts of the house. They are kind of, there's a lot of light, so I already get out of the room with sunglasses just so I don't get that transition too abruptly. So And when I go outside, I always have my sunglasses, always. And another thing that had a lot, and I still have a little bit, is dry eye. So I was using lubricating drops all the time, all the time, all the time. I would go through the flasks in no time. And right now it's better. I don't use the lubricating drops as much as I used before, so it's getting better. And also depends a lot on the place I am, because some places are very dry and you just get dry eye, even bad, but bad. But right now it's good. And when I go to bed, I use a lubricating gel because the eye drops, they last for just a few seconds, but the gel, it makes that layer that can last for longer, for a couple of hours or more. I'm not sure how many hours it can last, but it can last for longer, and it gives me a good night's sleep. Because before, I would wake up in the middle of the night and my eyes were so dry that I would have to physically open my eyes with my fingers, and that would hurt. But now I'm using the gel and it's fine. So that was it. Overall, I'm very satisfied with my surgery. If you are afraid of it, don't be. The procedure is very quick. It's relatively simple and it's safe. So there's no worry. Recovery time may take longer for you or maybe not. Everybody is different. Our bodies heal differently. So it changed my life completely. I was dependent on the glasses all the time, and now I'm not. Now I can just go around the world and use my new eyes, which I'm very excited to. Well, thanks for watching. Bye.